So when we look at the prevalence or incidence of lung cancer, in the United States right now, we're seeing about 230 to 245,000 cases a year. That's how many people are being diagnosed with lung cancer. How many people are dying from lung cancer is well over 140,000 of those patients. So right now, non-small cell lung cancer is the #1 cancer killer in the United States in both men and women. So we'll see more women diagnosed with breast cancer and more men diagnosed with prostate cancer. But lung cancer is going to kill more people than colon cancer, breast cancer, and prostate cancer combined this year. So lung cancer is still killing more of those patients, and the diagnosis rate is about #2 in both men and women. So unfortunately, most patients who are diagnosed with lung cancer are going to be diagnosed with late-stage disease. That is because when a tumor is growing in the lungs, there's a lot of lung. So a patient may have a tumor growing in the right lung, and it's getting larger, but the left lung is able to compensate, and the remaining unaffected right lung can compensate, so they don't feel short of breath. The tumor starts to grow into the middle airways, and when it's in the airways is when they develop a cough. Maybe they cough up blood. Maybe they start to feel more shortness of breath as more of the lung is involved. Well, by that time, it's actually very late. That's what we call locally advanced non-small cell or lung cancer. And when those patients have locally advanced disease, what happens is that the survival rate goes down significantly. So we would love to diagnose all lung cancer at stage 1, stage 1A, or 1A1, 1A2, 1A3. These very early small tumors that don't involve any of the lymph nodes and the opposite lung is unaffected. When we do that, we can do surgery and we can expect those patients to survive 5 years at about 90% rate or above. Unfortunately though, again, we diagnose at later stages where it's in the lymph nodes or it's spread to the other lung or to other places in the body, and we see survival goes down significantly. With our newer therapies in lung cancer, whether it's a targeted therapy that is directed towards a specific mutation in a protein, or if it's a more general therapy that includes immune checkpoint therapy or immune therapy, and we see more patients surviving even with later stage disease, but it's still not as good as when we find it early. So screening and early detection is key to saving lives in lung cancer. And so we have to increase the number of patients that are actually getting to screening so that we can diagnose these in stage 1 and actually have that cure rate that's running like 90+%.